was 17, didn't have any hair, long hair up till here. And I used to listen to rock music and stuff like that. And he said, by the way, just to tell you, he will not get his form. He said he's attended 6% of his classes. I didn't want to do pediatrics for sure. My father used to talk about diarrhea and malnutrition. I said, oh my God, who wants to do all this? The only time I really thought of was when I get bad marks in my inter-science. I said, chodo, let's go into IIT entrance examination karte hai. I mean, every time you met somebody, they would say, you're Dr. P.M. Udani's son. Became very difficult. I mean, everywhere you go. The only place it was not there was in the US. But one of the most important things for success is focus. One thing is, in all parts, we have to be scrupulously honest.
Hello everybody, this is Dr. Kaustubh Moite and welcome to yet another interesting episode of Doctors Outside Hospital. So this episode, we have got yet another interesting personality who I'm very sure if you are from a pediatric fraternity, you have heard about him. Everybody knows for the excellent academician that he is in the field of pediatric neurology, but very few know about how he reached this point, how he has achieved all these excellence over a period of 35 to 40 years of extreme hard work and dedication. Being a second generation doctor, he has made sure that the legacy of his father is being continued, and not just continued, but he has taken to another level, not only in the country but also internationally. So without wasting much time, let's get into the discussion with Dr. Vrajesh Udani, one of the most senior pediatric neurologists in the country. Good morning, sir.
Morning.
Thank you so much for accepting this invitation.
Not at all.
And you are giving your precious time to let you know more.
Not that precious. Go on.
No, so we know you for what great work you've done and for all the academic excellences that you've achieved, and through your multiple talks and your work in the field of neurology. But this talk is not for that. This talk is more about knowing you as a person and about you, how you came to this, how much efforts you have put into this, and it's mainly to inspire those young doctors who actually want to enter the field of pediatrics, and of course if they are more interested towards neurology. So first, before we start, sir, I just wanted to know, who is Dr. Vrajesh Udani as a person outside hospital?
That's a tough question. Basically, I'm a hedonist, if you want to call it that. So I love friends. I am very social. I have groups in different, my college mates, my school mates, my mates from Grand Medical College, my mates from whoever I've known afterwards, my mates from Hinduja. And we sort of, we lead a very active social life. I enjoy meeting people, talking about politics, which is very close to my heart, talking about, basically I find that a lot of my time is spent in conversations rather than reading, which I would love to do. But I'm a kind of a guy who loves to have fun.
Great. So just to put into brief, sir, can you just tell us in brief your story, maybe how were you in your school days from your medical trainings, then you went off to US and further on, just in brief.
So it's not a very exciting story. It is very mundane. I was basically I went to a school called St. Mary's. When I went in, I remember the second standard. I did terribly because I just didn't know how to speak English very well, and I understood English even less. And that's a problem which I face even now in my practice. I mean, when I'm evaluating children, you realize that they are learning in a language which they don't understand. You don't ever learn and in that kind of thing. You always learn in the language you speak at home, and that didn't happen. I used to speak Gujarati at home and maybe a little smattering of English, but nothing more. So first few years were bad. I mean, I remember the first, I was told by my parents that I flunked the test to get into St. Mary's, or not flunked, but did very badly, and I finally just got in by the... Then over time, things improved. You know, I had some very people who influenced me a lot. And there was a teacher called Mr. Rebello, who was an English teacher. And you know, in those days when you were learning English in the 5th and 6th, he came in the 6th, 7th standard, you tended to use funny words, you know. Instead of saying he's very, you know, you would use bigger words. For example, instead of speed, I would use the word velocity. Because it was, you know, I thought, why not use more fancy words? And he told me one very important thing, and I still remember that. He said, always speak in simple terms, never have this, because the more verbose you make it, the worse it sounds. And there were so many other, you know, St. Mary's was we had ISC at that time, we didn't have ICSA. So we used to go to England, the papers used to come from Cambridge and stuff like that. Then it improved. I used to play football, cricket, table tennis. Cricket I was terribly bad because I didn't realize till much later that my eye was bad on the left side. I was amblyopic. I couldn't. And finally, in this final exam, the ISC exam, I did fairly well, and I jumped. You know, in those days you could jump 1 year, and I went to InterScience. There was no 11th and 12th and all. There was 11th standard was when you finished your ISC, the 12th and 13th, so to speak. The 12th year you could jump. So I went to the 13th year, and I went to this college, Elphinstone, and you know, I was in an all-boys school. So all these girls and, you know, different kind of, and I went berserk. So I started smoking, I started gambling, I started all the bad things I sort of got. I was to go to these discos and spend time over there, and I never attended classes. And InterScience was pre-medical. I always thought I'd go into medical. Father, you know, always pushed me. Though I did have a affinity towards, I thought IIT would be a good idea to do, but frankly I was 17, didn't have any, I had long hair up till here, and I used to listen to rock music and stuff like that. And then my mother was a gynecologist, and she used to also do insurance work. And one day a lady came to her and said that, do you have a son in Elphinstone College? And she said, yes, I do. And he said, by the way, just to tell you, he will not get his form. So mother said, why? He said he's attended 6% of his classes. So obviously the night I really got a scolding and all this kind of thing. And I don't want to go into that, but essentially that lady, she was a patient of my mother's. She actually said, you ask him to come on Saturdays and even Sundays, and I'll arrange he can attend the classes and make up and all. And then there were 1 month or 1.5 months left for the exams, and I didn't know what to do. I had not touched organic chemistry, I had not touched physics. I mean, I used to do well in them. I didn't do anything. And finally we got I remember Mr. P.P. Rao was physics, and some other gentleman, Shivdasani, was in chemistry, in Jain College. And they used to come at 1 o'clock in the morning to teach me.
Oh, okay.
And I finished my InterScience, and the marks were, I thought I had maxed the papers and I was doing. And basically I just got into medical. I got the marks were just low enough, not me. So we were about 20 of us in that group, and we all got into Grand Medical, because Grand Medical was the one which took all stragglers like me. And the first thing in Grand Medical, we had to cut our hair because Dr. Chatriwala would allow us in the anatomy lecture hall. And slowly it got better. In Grand Medical, we organized the August melodies in the second year with Anand Joshi. I don't know if you know him. And we were both cultural side. We basically, August melodies was a program which was very attended by a lot of people, a lot of stars. We got 20 stars. And in that sense, we finally got into studying by the time we were in third MBBS. Second MBBS also was terrible because we were organizing these things, going to Pilani, all sorts of things. So really, I had a very interesting life. And I thought in Grand Medical, lovely people I met, people who are still my friends. And finally, in third MBBS, we studied, and did well in medicine, not too well in surgery or gynec, but enough to get through. And basically wanted to do neurology. I didn't want to do pediatrics for sure. My father used to talk about diarrhea and malnutrition. I said, oh my God, who wants to do all this? But in any case, it worked out. There was a lot of pressure from home. He wanted my eldest sister to do it. She didn't do it. He went to ophthalmology. My second sister, she pushed her into pediatrics and fine. She wanted to do it. I was interested in neurology. To make a long story short, I succumbed because in neurology, nothing was happening. The people were lying down with strokes or GBS or whatever. I used to go to adult neurology, and it looked like there's no treatment. So I went into pediatrics. Once I went to pediatrics, I couldn't stop thinking about neurology. So my second post actually was neurology with Dr. Singhal. And I had the time of my life. I was basically, Dr. Singhal used to teach in a visual way. He wouldn't talk too much, but he would do things and you would wonder what exactly he did for what reason. He would look at the field in a particular patient, only thing he would examine. And my registrar was my great friend Rajan Kale, and he would explain to me later why he did that. And that's how I learned, and he was a superb clinician. So basically that was it. I went to pediatrics, I finished my pediatrics, I was registered to Dr. Amdekar, and that was one of the great teachers in my life. People who really influenced me was my father. He used to teach us in undergraduate days. Dr. Amdekar, rational, all those things came. We used to have coffee in Grand Medical College. Every time he had a round, we used to go to the coffee club. It was really great. And then remember, the registrar was 2 years. It wasn't. So I was very fortunate. Born in a doctor's, the very famous doctor father, so it wasn't like hard work. It was, a lot of it was given, something which I always realized. That people who are much less privileged than I was have gone further than I have. And that's really something which, because they got into, after I finished my pediatrics, I did neurology pediatrics at Bombay Hospital with my father. And his clinical acumen was something which was amazing. Not because he was my father, but because he was, how to pick up science with observation. He taught me one very important thing. In pediatrics, never touch the patient. Let him sit in the mother's lap, you examine from far. And don't examine from close by. And then you start playing with the kid and you observe. And that has served me very well. And then, Singhal Saab, Amdekar Saab and my father. 3 were people who influenced me a lot. But that bug was in me. I wanted to do neurology. So I said I have to go somewhere. And I was told by Dr. Vadia, NH Vadia, that if you're doing pediatric neurology, don't do it over here. You have to go abroad. And England is not a good place because England didn't have established neurology programs. The only place in the world which had about 30-40 neurology programs was the US. Difficult to get in, but a lot of exams, finally got in over there. and I worked at Brooklyn, New York, which is at that time in the 80s was a very dangerous place to live. So we used to live in further away, and me and Sunu, we had married by that time. That's it. Became a neurologist, and then never thought of staying in the US, which was, I think sometimes I wonder whether we should have, and sometimes, but I came back, mother passed away, and then whole thing was essentially started neurology over here. Then wanted to do epilepsy. So I went back into Miami in '96 after I was in Hinduja for almost 5 years. And then basically came back, started epilepsy surgery, and I'm here.
Great, sir. So, in your story, you mentioned about the influence of your father. Do you feel by any way that because of both the parents being doctors, you were biased towards medicine, or had you not had a similar environment, you would be something else?
Yeah, I told you. I think I was very interested in maths, and I liked physics as a subject. Though of course, the influence in every dinner table, they'll be talking about cases and this and that, and he was a very powerful personality, as I'm sure you must have heard. He was very internationally very well known. He was always had. We used to know all these people. Dr. Suren Merchant and Dr. Lala from, I think, Patna, and Harish Chandra from, all these big names in pediatrics. All are behind ex-presidents of the IAP, and they used to come home. And we used to, have parties in the house, and Dr. Bilu, Barucha, and lots of people. And therefore the influence was, I think, more subconscious than anything else. So, yes, I probably, the only time I really thought of was when I get bad marks in my inter-science. I said, chodo, let's go into IIT entrance examination karte hai. But then I got into Grand Medical, and no regrets.
So, I shouldn't extrapolate it too much, but I can relate it really, my story towards yours. But any time did you feel that what if you couldn't live up to those expectations, or what if...
all the time. All the time. I mean, every time you met somebody, they would say, "You're Dr. P.M. Udani's son." Became very difficult. I mean, everywhere you go. The only place it was not there was in the US, because over there it was different people, different. Even there also, my boss over there, Dr. Arthur Rose, knew my father's name and TV and all that. So he would ask me. He asked me, when you come, are you that Udani's son and all that. But I'm just saying it was very difficult to live up to it. And I still haven't lived up to it. I mean, he was a giant. We are nowhere near that. But it's something which, you had to accept over time.
But, okay, so you are now focusing towards neurology, but if a general doctor, a first generation doctor who wants to enter in the field of pediatrics, would you still recommend him doing general pediatrics, or would you want him to focus towards one specific part?
I mean, there's a need for both. There is no question that general pediatricians are extremely important. I mean, many of the diseases which we face in pediatrics are preventable at the primary level. I mean, forget the vaccines and all, which are obvious, but even many things. For example, let's take autism. It's something which is widespread now. You see it all over the place. This pandemic has brought. And if you can identify that early, and who can identify it? He's the general pediatrician. If you identify in the first 18 months, you have a different outcome. You identify it 2-3 years, it's a different outcome. Specialists are needed. That's answer the question. The specialists are needed, yes. But specialists, the biggest problem in India is that subspecialties are not having much of training. So, I mean, this is almost in 2000 and I think 22 or something, DNB was approved. We have a DNB over here in Pediatric. 3 hospitals have it in the whole of India. DM is a smattering of some few colleges here and there. How do you become a neurologist? You can go for 2 years, 6 months, 1 year. But to learn neurology, you require 3 years. For example, other branches also. Where do you go if you want to do, I don't know about other branches, pediatric pulmonology maybe. You have to go abroad too.
Yeah, I had to like search for places. I couldn't find one in Mumbai, so I had to go to Bangalore and then to London.
Correct.
And then.
So that's what I'm saying. It's not easy, specialties, but you have to be trained. So unless you're trained fully, it becomes difficult to excel in your field.
So now there must be a number of students who have been trained under you. What specific change or what difference are you observing between maybe say medical training back then in your days and now, right now, in an like how different is a student coming out from a medical college getting trained under you? So what was the difference back then and what is happening right now?
Well, I think technology has changed a lot. And what is unfortunate is that we've forgotten, or not forgotten, but sort of basic clinical medicine has taken a sort of backseat. I mean, that I'm sure you must have heard this from many people. But the approach in those days and the approach in my initial years, when I've been training people from the early I've had Vadia Hospital, I started in the 90s. So I used to have people like Anaita Hegde and all these people who also worked with me. It was really nice, but we used to always have an approach of clinical first and then decide the tests and then do this. Now it has become quite different. So even my people who are trained under me, one thing I insist on is clinical. Don't look at the reports, because now though the fun in neurology has reduced. The detective work, which was very much there to decide the right test, first come to a diagnosis, decide the right tests, confirm it, and that feeling of satisfaction, or maybe even give treatment, because many diseases are not treatable. But still, to help out the patient understanding the disease and genetics and all this was done in a methodical way. That has now become, if they come to you and the patient tells you that I've got this rare genetic disease because the genetics has been done. So one thing I teach my fellows is, please do not look at the papers. Take your history, make your differentials, give a summary of the history. Then what do you think are the possibilities? Then you go into examination to just confirm, and you have to examine. And that's the,
So next very important thing that I wanted to ask you, and I'm pretty sure everybody else also wants to know, being in such a busy schedule, how do you manage your time? Like, do you have certain agendas, like you triage your time in such ways, like number 1 priority should be given to this, number 2, number 3?
It's one of the great unfortunate ways I have a problem of organization. Many people you may have talked to, Tom Digger, I'm sure I remember, I used to be terrible at time management. And even in as a resident doctor, you would come a little late for his rounds. It was terrible. I'm got ADHD, I think, and I was very disorganized, and that's one of the reasons which is. So I don't have these priorities. You should have. I agree. It's one of the most important things for success is focus, and to actually. Slot your times for things which, I know all this is theory, but putting it in practice has always been difficult for me. But I try my best, and then I prioritize according to, but it doesn't, I don't write down lists and all those things which are important for good, work ethics. That is an unfortunate thing.
We appreciate your honest answer. We appreciate your honest answer.
I mean, one of the things which I regret, maybe you ask me what is the biggest thing I regret. I mean, I've gone through 35 years of this specialty, and I have some papers, nothing to be very proud of. I've been involved in a few diseases, discoveries, a couple of diseases, but nothing great. Why? Because you need organization to do research, clinical research. You need data. You need, a lot of stuff. And we don't spend that money. That's because of organization. If you want to do research and you want to teach and you want to do clinical practice, it's very difficult. And that's why if you, as a young person, keep data, use the computer. There's so many tools nowadays. We used to have books. My first, I think, 50, 60 cases of epilepsy surgery, I had a book when I used to write the diagnosis, what the treatment was, what surgery we did, etc., what the follow-up was. That book got lost in this shuffling of offices. But then, no, so all that data is gone, and that is why I'm saying every young person should have a. And there, I think I attended this conference in Goa. There's this excellent tools in the computer. I think that is a computer. What is it called? The IAP chapter, computer chapter, or whatever. And they tell you how to save your stuff, how to organize your life, how to organize your work, and that will give you great benefits.
Quick 2 questions, sir. If in a parallel universe you were not a doctor, what would you be?
The tough answer, but I would be in banking. I mean, I would be in finance.
Finance. Excellent. Second, what are your hobbies?
Well, I love horse racing.
Okay.
So I have friends who are, we used to go in college, and I never owned a horse, though I've come very close to owning a horse. But the expense is just too much for a pediatric neurologist. But basically, every, Pune season starts sometime in July. In fact, I think the next 3 weeks it's there. And then there's the Bombay season. It's very unfortunate that it's closing down. Not closing down, but it's reducing because the interest and the support from the. So that's one thing. Second thing, I like watching. I like bridge. I used to be a college bridge player. So I used to like, but hobbies, unfortunately, haven't found time to play bridge regularly. And of course, I like watching sports. And the sports, the match was superb this time. And then there were, I like watching tennis.
Excellent.
That's and movies. I love movies. Movies. My wife and I, we like to see a lot of good movies. I like, serious films, and basically always like to go to festivals. I love music, so I go to all genres of music, right from rock to old Bollywood to Hindustani classical. So all those things
Favorite
I like,
artist,
but the
sir?
problem is when do you find the time?
Favorite artist?
Of which genre?
You choose favorite genre, favorite artist.
Okay, so the Hindustani classical, it was always Bhimsen Joshi.
Okay.
In Hindi, Bollywood, it is always Mohammad Rafi and Kishore Kumar. In Western music, it was Pink Floyd. I'll just give you that name, one because the Beatles, of course, and Michael Jackson, and Whitney Houston, and in what other genres are left? I've recently found Shankar Mahadevan, and I think he is one of the most. In Hindustani classical, Zakir Hussain. And Shiv Kumar, or the Sharma, I think, the guy who plays the.
Excellent, sir. So we've already taken a lot of time, but just to wind it up, just a few points of advice, life lessons, what you have learned in the last 35 years of your practice, or probably more than that, just to wind it up, sir.
Well, one thing is, in all parts, we have to be scrupulously honest. You have to have scrupulously honest means, and you have to put the patient's interest before your own. That's something which, that seems to be declining over the years. Doing unnecessary procedures, asking for unnecessary tests. You have to understand. Number 2 is empathy. You have to put yourself in the patient's place and see his point or her point of view, and that is very difficult. They're sometimes very irritating patients, and they are demanding, but the way they behave at that time is not their natural nature. It is because their child is sick, and the kind of prognosis you give, So it's a different kind of that. So those are the two things in practice. And of course, as far as academics is concerned, you have to keep reading, attend. If you're not a great reader, attend CMEs, attend conferences. You have to keep up. It's just not possible to do otherwise. So, and third, organization.
Excellent. Thank you so much, sir, for your valuable time.
I don't know whether I took too much time, but I just
No, sir.
give you everything and you can edit whatever you want.
No, sir. I don't think we need to edit anything. But even while in our last talk, Sambikar sir also really spoke highly about you. So he was telling.
He's always been my mentor, and
so he was actually telling how the cards have changed when he used to teach you, and there are times when you teach him, and that is the most
I think
proud moment.
He's just being modest. Yeah, I think.
And so are you, sir. Okay, thank you so much, sir. Thank you so much. Yeah.